Good morning. Welcome to XME Medical. We are live. We have a very important and special guest with us today. A little introduction beforehand. My name is Dr. Hamza. Some of you have seen me. It's been a while since I've been on air. It's a beautiful sunny day. XME Medical bringing you a virtual platform in which to basically the agenda is to help and guide healthcare students and make we can gradually correspond our generic and authentic information down to the medical students that need it. And without further ado, let me introduce to you Dr. Rola Rabah.
Hello.
Hey, Dr. Rola, how are you?
Good. Thank you so much for having me.
To help have you on our show, welcome to XME Medical. How's your day going so far?
It's great. It's a rather gloomy day, but it's going to be warm, so I'll take it.
That is good. That is good. So we have a question for our audience. Why don't you tell us a little bit about yourself as an introduction?
Sure. So my name is Rola Rabah. I am an oral maxillofacial surgery resident at Boston University. So I'm in Boston, Massachusetts, in the United States. I am finishing up my 5th year out of 6 of residency. So I have been through this residency for the last 5 years. I've got one more year to go, and then I graduate. And I'm
Oh, wow. We're having a bit of a connection issue. Are you there with us? We're having a bit of a connection issue. Joining us in a little while. Oh, there you are.
sorry, I don't know what's going
You're
on.
back.
I'm back.
That's all right. It happens. So, how does it feel to finally finish up school? You're like in your final year of residency.
Yep, in 1 month I'm officially in my final year of residency. It's crazy. I've been through this journey for so long. So, in order to become an oral maxillofacial surgery resident, you have to first, of course, finish undergrad. So here in the States, you have to do 4 years of undergraduate education, and that could be pretty much in any degree. So I got a degree from UC Berkeley in microbial biology. And after that, I took a couple of years off and then applied to dental schools. I went to NYU College of Dentistry, finished 4 years of dental school. And then it was within dental school that I decided to pursue oral maxillofacial surgery. And so in dental school, I applied to oral surgery, got into oral surgery, and that's a 6-year residency. Part of that residency, you do a accelerated medical school program. You get your MD, and then you do your surgical training for the final part of your residency. So it's been a long time coming,
Oh,
and
wow.
finally
Yeah, I
the light is
bet.
a little bit at the end of.
But the years go by, right? The years finish up. Did you
Yeah, so
notice
there
along that line?
Yeah, there's a really famous saying, as soon as you start residency and you don't really understand what it means until the end, but they say the days are long, but the years are short. And it's absolutely true. Like your day to day feels very draining and very long, but then you blink and you're like in your final year of residency.
Oh, wow. So a popular question, and
Uh,
a lot of viewers want to know, where did the name you're handling social media name 15 Blades come from?
yes, I get this question all the time. Actually 15 blades. The 15 blade is a surgical blade that is used. It's a very, very, very common blade. There's different types of blades and they're all numbered differently, but the 15 blade is a very common universal blade, and it very often makes the first cut in surgery. And for
Oh,
whatever reason, when I started my online journey, I really wanted a name that embodied what I wanted to try and do on this platform, which was make like the first cut as a young female oral surgery resident. There's really not very many of us out there in general, and especially on social media when I first started. And so the name 15 Blades kind of just gave me inspiration because it's often the first thing, the first step anytime you start a surgery. And very commonly you hear someone say 15 blade and they make the first incision, and that's really when the surgery starts. And so it was kind of a special name, but I realize that a lot of people may not understand the significance of 15
I
blade.
had to ask it. I just had to ask it.
Yeah,
But now we know. So
that's right.
is being an OMFS is something you always wanted to do, or was there like any profession you thought that you want to get into?
Yeah, absolutely not. I had no idea what oral surgery was. Like literally no clue. I had never been to a max face surgeon. I honestly didn't know very much about it at all, which is very different than a lot of people who pursue OMFS, because it's very competitive. And so people who generally pursue it are like gun ho. When they start dental school, they know they're going to apply to OMFS residencies. And so they do a ton of research. I didn't make that decision until very late in the game. I was starting my third year of dental school, and people generally apply during that time. And so it was very late in the game, but I was inspired during my dental school rotations. I went into an orthognathic surgery, and this is a very common story. You either love the surgery or you hate it. And I just
Oh yeah.
loved it. I knew where I wanted to be. So
That's good because a lot of people still struggle on where they want to do, and they don't really get that
yeah.
until they're like final year of med school.
Yeah, it's very true. And I don't think it's a bad thing, because what ends up happening is you really, once you make that decision, it's not like a arbitrary decision that you made from the very beginning. Like I had a lot of friends who were, even one of my best friends in medical school, she was always gun ho, like I'm going to do hemonc, I'm going to become an oncologist, a medical oncologist. And, that's what she was set on. And as soon as she did her, oncology rotation, was really like hands-on taking care of patients, she really didn't like it, and now has totally switched into another field. So when you have like a narrow tunneled vision from the very beginning, you might make the wrong decision. It's not to say that some people don't know what they're doing and love it and can get there, and will end up loving it forever. But if you have
Right.
that vision, you might miss something else that you can really, really, really be passionate about.
So juicy question: was there any speciality that you felt like me right now? I can't do this.
So initially, I thought I was going to do pediatric dentist, and then I started working with kids, and I was like, don't think so.
Oh yeah, it happens. Pediatrics is something else.
No, totally different. I mean, to be fair, I like working on children now, and I really value my pediatric patients that come in that need some sort of oral surgery procedure. But it's not like all day, every day pediatric dentistry. You have to be a very, very special person to be, working with children 24/7, and it was just not me.
Oh wow. I mean, that's for a lot of people. Don't worry, you're not alone.
Yeah.
Bring it to something serious. Like, I know a lot of students, especially in the US, like after medical school or before medical school, they take a gap year.
Hmm.
Maybe it's because they turned in their application late. Maybe they just want to take that year,
Hmm.
make their CV better. Do you Would you recommend something like that
Yeah.
to take some?
So it's, of course, it's any question that I answer today is always going to be on a case by case basis. Not everybody
Right.
has to follow the same path as somebody else. But I do think in general, medicine is a very long journey. And a lot of times for people who are in medicine, they're really type A personality. They're very passionate and all of these amazing traits. And one of the things that happens is you're in a hurry to always achieve the next thing. And you end up like finding yourself 10 years into your career and you really haven't had any time to find yourself or do things that maybe are outside of this field. So I actually took 3 years between undergraduate education and dental school.
Oh, okay.
And it was probably one of the best decisions that I made. I ended up teaching during that time. I ended up making really, I had a really strong relationship with my sisters, which I may not have had because they were younger than me. And so if I had just gone off and never really come back to my family's home, I might have
Right.
not developed those relationships. And now we're very close and they're my biggest supports. So it can allow you to do something that you may not be able to do in the future. Like I can't imagine going back home now for 3 years. It just is not in my
Right.
pathway. And maybe I would have never developed those strong relationships with my siblings. Maybe I would have never taught, which I really enjoyed. Maybe I would have chosen a different path. And so, and maybe I would have been burnt out and ended up
Right.
not going through with oral surgery since it was a 6 year residency. Maybe at that stage, I would have been like, oh my God, I can't imagine doing more because I was so tired. But because I took those 3 years, I feel like I really, I deviated from that path and it was a positive thing for me. So if that is within if that is an option and you're struggling with that choice, I would take it because you will be surprised what opportunities arise during that time.
Right. I mean, I completely get that because I am an IMG. I'm a US IMG. So when I came
Yeah,
back, I have three other siblings. So by the time I came back, they graduated high school. They were in their different phases. I felt like that life that I was not a part of. Makes sense.
exactly.
Um, so a basic thing, I know you mentioned this before, but everyone is asking, mashallah, you are a DDS. Could you take us a little bit about your career pathway and like explain the difference between like in an OMFS 4 years and 6 year as well?
Sure. So in oral surgery, you can take two pathways. You could do a 4 year or a 6 year program, like you mentioned. Essentially, the surgical training is the same with both pathways, but the 6 year program gives you a medical degree. So you become an MD as well. And people that make that choice are generally people who may end up in academia in the future, or maybe they want to do a fellowship like craniofacial fellowship or head and neck oncology. These are the types of people that generally will take the 6 year track, or sometimes someone like me who just wanted the extra opportunity and to keep doors open. I didn't really know what I wanted to do exactly once I was within oral maxillofacial surgery. So I just wanted to keep my doors open. And that's why I chose the 6 year program. It is a longer program. Generally speaking, in the US, you do have to pay tuition,
Right.
and it's an added cost. So it's definitely a very important decision that you have to make and be okay with. I really, ask me in 10 years, maybe my answer will be different. But at this stage in my life, yes, it has been a really long time, but I really value and appreciate my medical degree. I feel that when I'm in the hospital, I really have a really deep understanding of complex patient care. I feel that I'm very well rounded because I've done both dental school and medical school. I feel like I have this like really unique opportunity to make an impact in both fields, and I think that's really important. And so for me, it was really keeping the door open for that opportunity. And that's why I made that decision. But oral maxillofacial surgery is a residency that you have to do in the US after dental school. I know that in Europe,
Okay.
you go through medical school first, and then
Yeah.
dentistry. And so it is a little bit different based on where you are. But here in the States, you have to finish a 4-year dental education. Once you're done with your, whether it's DDS and DMD, here's a little secret. There's no difference between DDS or DMD. It's literally the same
Oh
exact,
wow.
just meant to confuse everyone.
Oh
Uh,
okay.
but it's literally doctor of dental surgery versus doctor of I think DMD is doctor of med. It's Latin, but it's literally
Okay.
the exact degree. But certain dental schools do a DDS and certain dental schools do a DMD. And so, regardless of which degree you end up getting, then you can apply to oral maxillofacial surgery, and that's when you make the decision 4-year versus 6. And so that's why you'll see oral surgeons who don't have the MD and oral surgeons that do have the MD, and the
Right.
surgical training is essentially the same. They're both competent to do, you know, the full scope of oral surgery. Really, the only difference is a medical degree.
Right. We have another question here. So there's also an intern year, right? And like, what is expected of you as an intern or expected of you as a first year resident? Is there a difference
So,
between the
good
two?
question. And this is something that people are confused about if they aren't in the medical field. An intern, there's two types of interns. You can be a categorical intern and a non-categorical intern. Another term that I've heard is preliminary intern. And that's an intern, a non-categorical intern or a preliminary intern is an intern who does intern year, but they're not necessarily in a residency program yet. So this is a
Right.
good option for someone who is considering the residency but don't know if they want to do it, and so they do this preliminary year. You're still treated like an intern. You do a lot of the rotations, but you're not in a program. Versus a categorical intern or an intern that's already in residency. That intern is just doing their first year of residency. So next year they'll advance and progress and become a second year resident. So I get a lot of questions
Um,
about the difference in that. And essentially, as an intern, your job is really to understand, patient care, to understand
right.
how to do all of the basics, because intern year is your foundation for everything. So, our interns take call because that's where you learn the most, is when you're on call on the job. You do a lot of in oral surgery, you're doing a lot of the basics. So a lot of dentoalveolar, you're getting introduced to
Right.
extractions, implants, basic things like that. And then year by year, those skills you're building a little bit on top of that, on top of that, on top of that, until you're ready to graduate and you've learned complex surgical skills.
This is according to like OMFS. This is another question regarding that. What kind of procedures are involved exactly as an OMF? What procedures do you see more often? Sorry about the connection, guys. She is. There we go.
Sorry about the connection. So the
No
question
worries.
was, I didn't hear the full question.
What kind of procedures do you see more often as an OMFS resident or as a surgeon?
So, as an OMFS resident specifically, we do, of course, tons of dental alveolar. So, wisdom teeth extractions, we place implants to replace missing teeth. We do that in all sorts of different ways, whether it's robotic or navigation with the computer or just free-handed. And so those are really a lot of bread and butter everyday procedures. But of course, we do a ton of complex procedures like facial reconstruction for cancer. We do resections, lots of different pathology. We do orthognathic surgery. So that's resetting the jaw forward or back if people have a skeletal malocclusion. So the easiest way for me to show is like if somebody's like this, then we reset their jaw and put it back. Um,
Okay.
Yeah, cosmetic surgery. Lots of the scope of practice under maxillofacial is really huge. It's really surgery from the neck up.
Right, right. Um, that's actually very interesting. Had me
Yeah.
there's a lot of things going into that. Pathways. Let's say you graduated, right? You graduated dental school. What options are given to you as a dental student?
Yeah, very good question. Lots of different options. I can list some of them. So, of course, you can be a general dentist and you could do a general practice residency, which is 1 year. A lot of people do that option. It just gives them more complex cases in general dentistry. You can think of that as just like a general practitioner, like primary care. Um, you could do oral surgery, of course, the 4 or the 6 year track. You can do orthodontics, so that's braces and all sorts of things like that. That's about 3 years. You could do
Right.
periodontics, people that deal with gum surgery, prosthodontics, so a lot of full mouth rehabilitation, complex cases where people need, dentures or restorative options like that. And then uh, uh, finally, there are a lot of other residencies, but oral pathology is a residency. You could do radiology and be a specialist, and dental anesthesia as well. And then endodontics, and so root canal therapy, pediatrics, and specialize in pediatric children. So actually, a lot of different dental residency
Oh wow.
options.
So it's basically like if you're graduating from med school, it's the same amount of options you have as a dental student.
Absolutely, absolutely, tons and tons and tons and tons.
One more that we have here is do you, it's actually a very good question. Do you recommend a specific skill one should have to be a surgeon, or do you just learn that skill over time?
That's an interesting. I actually don't know if I've been ever that. I don't think you need to like. I know people joke all the time, like, "Oh, stick your hand out and see if you shake." That's all. That's all crap. Don't listen to that.
Yeah.
Uh, that has nothing to do with anything. I think one skill you should have if you want to pursue surgery has got to be resilience.
Right.
That's more of something that you have to practice, in terms of just like your day to day and less hand skills. I don't think you need hand skills to be a great surgeon. That's something that
Right.
really taught. And practice really does make a huge difference for that type of scenario. No surgeon's ever born a surgeon, without going through the training. But being resilient, meaning getting through a really difficult residency, getting through a really difficult surgery, getting through a
Long
really
hours.
long hours. I think that is a skill that you really, really need to have.
Right, right. Ooh, okay, now that we're back to studying, this is gonna probably take a while. What kind of board do you take to reach to the point that you're in?
Oh my God. I cannot list the amount of board taken at this point. I mean, just to start, I've taken all of the USMLE exams in order to get my MD. So USMLE 1, 2, and 3. And that was before it was pass fail. Let me tell you, it was very
Oh yeah.
stressful. So I've taken all of the USMLEs. I've taken both of the dental boards. I've taken the dental licensing exams. I have taken more board exams that I can list. And you can imagine if when you're trying to become a dentist or you're trying to become a physician, there's tons of exams and boards, and I've done both. So it's a lot.
um, so back to the step one exam, because we have a lot of our viewers still giving step one, especially now that it's a pass or fail. What
Right.
is an ideal way that you found a study method to be effective, especially step one wise?
Sure. So I have a ton of YouTube videos, so make sure you check out my channel on YouTube. But specifically for USMLE, there is so much information that you have to really understand and master. My biggest advice is not rushing through the material, reading complex material once over is not sufficient. Being able to allocate enough time for yourself, even if it means having to take an extra year or extra several months, to be able to read the information, understand the information, and then constantly repeat the information is absolutely key. I can tell you right now, all of the things that I learned in USMLE that actually are things that I am using now in practice are so simple now. And when I was learning them for the USMLE, they were the most difficult concepts. And the reason why they're so simple now is because I have seen them over and over and over and over again. And that makes it so much easier. So I highly recommend, if you are setting a goal for yourself, give yourself time to see the information over and over and over again. That will make your learning so much easier. Repetition is really key when it comes to medicine.
Oh yeah. So before like scoring high off of the exams, like what are some top check off item list one should have when applying to a surgical residency? I guess
You
they're asking about CV now too.
Yeah, so CV is really important. In my opinion, your CV is more important than USMLE scores and your exams and whatnot, because anybody could score well on an exam if they study long enough for it. Anyone, put anyone in a room, lock them up, and have them study 24/7 for 6 months, and they'll score perfect, USMLE score. It's not about that. That doesn't make a good doctor, and I think programs understand that now. What they're looking for is a well-rounded person, meaning you've put in effort, you've done some shadowing, you've done some volunteer work, you've done some community service, you've done you've been able to really show them that you want to be a doctor for the right reasons, and that means that you're someone who's well-rounded and passionate and has other interests. I think that's really important. And you don't want to put so much on your CV that it looks like you're lost and you don't have a focus, and
Right.
really focus a couple of things that you're very passionate about, and that will show in your CV. If you've been a tennis player your whole life and you really love tennis, make sure that you focus on that. I'm part of a tennis association. I've played tennis
Right.
for 12 years. I've done this for tennis, and like really embody that instead of being like tennis, volleyball, basketball, running, skating, blah, blah. Like that's not very impressive. You're like, oh, you're like dipping your toes in all of these different things. You're probably not that good at all of them. Versus just like really being focused on something and showing that you're really
Right.
passionate.
Right. And that is a very good point. Regarding that as well, like, because we had another follow up question to that is that what do you think of should be an appropriate time to do research and electives? And does that help board exams to, get your CV on point?
Absolutely. So, unfortunately, I get tons of questions specifically about international students applying to U.S. schools, and unfortunately, I don't really know much about it because I did my entire education here in the States, essentially. But I
Right.
do know that a lot of competition out there, and the ones that make the cut are the ones who truly have shown a commitment over the years. And so it's really important, like I said, if you're, I'll keep using the tennis example because I think it's an example outside of the realm
It's a good
of
example.
medicine itself. But let's say you're a passionate tennis player. They really want to see that you've done that since you were 12 years old, and you've done things throughout the years to show how passionate you have been about it. So maybe you won an award for tennis, a year ago. Maybe you went to a tennis intensive camp 3 years ago. Maybe you're part of a tennis club that you're the president of. It's not you don't have to be like the president of your university to stand out. It's just that you have to show that you have this commitment to something that you're passionate about, because that's what the field of medicine is. You have a passion to help people, and you have a passion to be a doctor, and those are the most excellent doctors, and you have to have that passion for a very long time. You can't just like hop
Agreed.
from thing to thing.
Oh, yeah. It's definitely about passion and your drive, especially trying to get in the field. It's a very competitive
Exactly.
field out there. Exciting question actually, what are your top survival for as a resident or even medical school?
This is very easy. Sleep anytime you can, eat anytime you can, have fun anytime you can. You have to do things in this long journey that keep you alive, and you can't do it if you're all work no play. So my biggest survival tip is take the time for yourself.
Right,
No.
right. And also, it's actually, what were your greatest challenge being a female resident? Did you have any at that time, especially being an Arab? And, was there any
Yeah.
challenges that faced you?
Yeah, absolutely. This is a good question. So, there's always challenges, whoever you are, wherever you are. I think for a female in surgery, there's definitely a challenge because you're a minority. And anytime you're a minority in anything, I feel like that we put this extra pressure on ourselves because we always want to prove ourselves, because you don't want to, you already feel like you stand out and you don't want to be any different than anyone else. So I think one of the challenges is really being comfortable with yourself and not letting the pressure of being the minority affect you. I think that's really important, and something that I struggled with personally, because for so long I always felt like I was in competition. And you are in competition because you're in a competitive field, but you shouldn't be in competition just because you're a minority. And I think that's really important. Whether you're a minority because of your ethnicity or because of your gender, you have to just kind of embrace the experience and the different background that you bring and use that to your advantage. So, for
Right.
example, I get my patients, they tell me all the time, wow, you're so young. Like, are you, how long? And I can see that they're worried because they're like, have you done this before? And I'm like, yes, like I'm a chief resident, basically. Like I've done this plenty of times. Trust me. Like your tooth extraction doesn't scare me. But they don't know that.
Right.
Instead of being like, oh, so offended and I'm so over it, these people, they don't believe in me, I just turn it into a joke. They'll say that to me and I'll be like, well, lucky for you, I don't look like a doctor, and you don't have to be scared. You don't have to have hypertension, because we're just gonna have fun. And they'll laugh at it, you'll make a joke out of it, and you just kind of like connect a little bit with your patients. And so you have to just use that to your advantage instead of feeling like you're at a disadvantage.
Speaking of that, a lot of people, especially in med school, and I mean, I've felt it before too, and
Yeah.
they lose motivation sometimes. What
I,
is your like greatest advice for this generation, or maybe the people that are going through it?
um, 1 second. Sorry. I think
No worries.
there we go. So losing motivation, that goes back to my first point, which is taking care of yourself. If you are somebody who has balance in your life, you're less likely to burn out. And burnout comes in all sorts of forms. It can come from emotional burnout, physical burnout. You can like physically become too tired. You can have mental burnout where you physically cannot comprehend more information. So burnout is very real, and the only way to avoid burnout is balance. You cannot stick yourself in a dark room studying all day long for hours and hours and hours and hours without scheduling time for
True.
yourself, breaks, and see loved ones and hang out with people you care about and you love. That's incredibly important. One of the reasons why I have a social media account and why I've really stuck to it, even though honestly sometimes it's a lot of my time, it's a lot of effort, but one of the reasons why I've really stuck with it is because it gives me that very much needed break. And it reminds me throughout the day, even when I go on my Instagram story and I post something, it gives me that opportunity to be able to remove myself from this overwhelming situation that I might be in. And it helps me schedule these breaks, and that's really, really important. So you can't be all work, no play. You will burn out. And I think that is, something that I really want to drive home, because unfortunately, people drop out of medicine. And even worse, people might, become really depressed, or have thoughts of harming themselves or something, like really get into this dark place of overwhelming, and I don't want to take it there and kind of turn our conversation that area, but like it's something that we really have to, as a community in medicine,
Right.
do better for ourselves, so that we encourage others around us to never be in that situation.
Right. I mean, a lot of students that I teach myself, I tell them mental health is very important, no
Yeah,
matter what career you're in.
and I
So
think
that is one of the
pe-
things.
people use think that it's a weakness, but it's really not. It's really
Yeah, it's okay. Everyone needs help, and this is why we're building a community,
it,
especially influencers, especially
yep.
doctors out there. We have a question from one of our female audience, and it's a very great question. Is that sometimes, especially as an like international medical graduate, you take, you drop out, you have kids sometimes, and then you take that long break, right? How back into the field? We're talking
So
about
it's a
more
little bit.
than 2 years,
Yeah, it's a little bit difficult for me to answer that question because I'm not really in that situation, and I don't know very many
right?
people in that situation, but I do know I have colleagues who have taken time to start their families and have children and step away from the field, and once they were ready, came back at their own time. And I think that goes back to our point of balance. If that is something that's important to you, then that's what you need to do, because at the end of the day, you're a provider, but in order to be a provider, you have to have provided for yourself. Self-care is not selfish, it's actually selfless, because if you're not caring for yourself, you can't give the very best to your patients. And so
Yeah,
if you're a female physician and you want to take time to have a baby, and that's important to you, then that's what you need to do. Otherwise, you're going to live a life of regret, and maybe even you'll be resentful to the career that you chose because it didn't allow you the time. If you're a male and you want to take time to do research or take sabbatical or have a baby, and you're a male and you want to take time to raise your child with
yeah,
your partner, that is what you need to do, because otherwise, it this is a career and it is a lifestyle, but it is not the end all be all. And so, how difficult is it for you to integrate back after a couple of years? I don't know how to answer that question because I've never really done that, and I don't have children myself, but I do believe that it's incredibly important for females to make sure that if they're passionate, to come back into the field so that they can create a community where that's okay.
right. Um, Now, once we've answered those questions, we're kind of stepping back towards research because a lot of people are just blowing up the comment section with research. You've, mashallah, done research papers. What is your recommendation in connecting with doctors about research and how to get one?
Yes, I get a ton of emails, asking me to do research and to come shadow at hospitals. And unfortunately, in the US specifically, because of a lot of privacy laws and a lot of restrictions, it's extremely difficult to go through the hospital system in order to
Right,
do research if you're not already an employee or if you're already not on campus. So it's really, really difficult to do that. If you are interested in something like that, I would really encourage that you look up the university that's associated with the hospital. So, for example, I'm at Boston Medical Center. The university that's associated with our hospital is Boston University. Now, you don't have to do research in Boston University Medical School. You can do research anywhere in Boston.
voice kind of blurred out. Yeah, inaudible right now, which is weird. You're Oh, I
Hello?
think now it's back. Now it's back. Good. We got towards the last. Hello. Yeah, now it's good. Hello, can you hear me? Network connection. Hello. So we're having network connections, but she'll be right back. Keep on. I'm trying to get through as many as I can today. are going to still answer these questions. We have around 20 minutes, but just let me know what questions you have, and I'm trying to read through all the comment stage and ask as many as I can. She'll be back. She disconnected for a little bit. We have around 15 minutes. There she is. She's back.
Do you hear? Hi.
Yeah, for some reason your audio went out, but your camera was moving.
Oh yeah, I couldn't hear you, so I was like trying to turn things on and off, and it wasn't working.
That's okay. Okay, moving on to our next question because we have around 20 minutes left. I'm gonna try to end it a bit earlier because I know you have to go as well. But oh, this is a huge one actually. I don't know if it's a red flag because I don't know the answer to this as well. How do you think healthcare hospitals slash companies can make annual efforts towards improving the culture for flexible work life integration for working mothers or female mentors?
Oof.
It's a mouthful. I told you.
Oof. That is a big question. It's an excellent question, something I've been thinking about a lot lately. And the reason that I've been thinking about it is I've posted several times. I have friends who have taken maternity leave, and they leave for like 4 weeks and come back, and as many mothers or even people in the healthcare field know that giving birth and bonding with your child takes a little bit longer than 4 weeks, and a lot of people take even less than that. And when I've talked about that before on my channel, I've gotten messages from like Europe and different countries in Europe being like, we take 6 months, we take 4 months. Oh my God, I can't believe it's only a couple of weeks. And so I realize that there's a huge discrepancy between what certain countries do in the US. And I think that's changing though, with a lot of people being a lot more outspoken about what they need and what they want. I think things that have changed, even at my own hospital, all of a sudden I'm seeing these secure areas for breastfeeding mothers to pump. We never had that before. Basically breastfeeding mothers had to find a random, bathroom that they could go into, that they could lock the door and pump. And now I've seen these new, because I think there's a big movement. So hospitals really need to understand the fact that women are now a big part of the workforce. And in order to maintain these employees and maintain a strong workforce, you have to make accommodations that that help them. Anytime that you have a workforce that you want to keep, which is a huge advantage for any company, whether it's healthcare, whether it's Google, whether it's Facebook, whatever company it is, you have to be able to accommodate for your workforce. And right now, women are making up a huge workforce in the healthcare field. And so if you want mothers to continue to be providers, you have to make those accommodations. And the only way that that can happen is if women advocate for it and men support it. So I
Right.
think that's what we need to really focus on.
Well, my support is there. I'm there. So, um,
Great.
another thing is, mashallah, you handle a social media blog. You're a content creator. You're a blogger, entrepreneur, and on top of that, you're also an oral maxillofacial surgeon resident. For those viewers that missed it, how do you manage all that? Like, is there any days where you felt like this part of my life took over there for like new people that are trying to get out there?
Again, life is really all about balance. I have made a very conscious effort to balance my work life with my social life, with my career life. And that's important to me because it really helps with my mental health and my emotional health. And so, as long as you're able to identify your priorities and be flexible, I think you can make anything happen. And what I mean by that is, maybe today I have two research projects and I can't do my social media. And so I take a break from social media and I focus on my residency. Maybe tomorrow I have a weekend off and I don't really have to do too much for my residency and I focus a little bit on my social media. Maybe the following week. So it's all a balance and it's all give and take. And so as long as you're able to prioritize and say, my residency is really important to me, my family is really important to me, and my social media is really important to me, and you identify these three things that you want to prioritize, then you can make time for them because you just have to be flexible and find the time. But you can't say I'm going to prioritize 25 different things. That's just not going to work. You have to be able to identify the things that are really important for you. For example, I don't really go out and party and stay up till 2, 3 a.m. It's just not what I like to do. And some
Right.
people that they like to do. So for me, I've eliminated that, which means I go to bed early, I wake up early, and I'm a lot more efficient during the day when I have a weekend off. So I can do some reading for my residency, do some research, and even get in, a couple of hours of social media content. If I wanted to go
Right.
out and do all of that stuff, I could do that, but I would have to cut something else out of the day the next day. So you have to just make sure that you're really focused on what it is that you are prioritizing, what you want to do.
Right. I mean, at the end of the day, it's just balance. So going back to, because a lot of people missed it, what is the difference between a 4-year OMFS and a 6-year OMFS?
So in very short summary, it's really a 2 year, the 2 year difference is a medical degree. So the six
Hmm.
year track, you get a medical degree and it's an accelerated medical program. So you become a dual degree MD, DDS or DMD. And in the other aspect, the 4 year program, you're an oral surgeon and you're a DDS or a DMD, but you don't get a medical degree.
Right. And another one that we have here is, let's say you have your CV in front of you, right? You've taken your board exams. What do you think? I mean, I know you specified like that yourself. What are your strengths, right, on a CV? What else do you think that could put like cream on the top if you're applying for a residency in the cycle?
I think because a lot of residency programs are associated with academic centers, or maybe all of them are, research is the sweet cherry on top that you can really put on your CV. Companies, hospitals, academic centers, universities, everybody loves research. Everybody loves research because that's what, you can say, this is based on research, this is based on research, and everybody's looking for someone to publish research. So if you're able to do research, then that's really important.
Right. When do you think is a proper time for, like, let's say a medical student to do research? Should he wait after he
There,
takes his board
there,
exams, he or she?
as soon
No
as possible.
problem. As soon as possible.
As soon as
That's
possible.
good.
Or you want your research to be substantial, so you don't want to just do a small little research project that doesn't end anywhere. If you are doing a long time research project that ends up being published, or you end up presenting it at some sort of conference, or you end up working with someone important, or you end up, that is amazing. I mean research could really get you places.
Right, right. And on top of this is actually a question for you specifically. Um, so what happens after you get done with residency? What is the next step for you?
So I'm gonna find a job. We'll see where I end up. I'm still trying to figure things out. I have no idea. I'll let you guys know. Make sure you tune in and stay up to date on my Instagram because whenever I have big news, that's where I share it. But yeah, I have no idea. But I think job is what I need at this point.
Everyone does, and especially like you don't expect like after you're at the end of the tunnel. I mean, you've been in school for so long that you're like, oh, I'm going to keep on going.
Full student. I've been a student forever.
Okay. This is, um, we're going to try to wrap this up. But this is another juicy question for you. What was like your most highlighted moment that like melted your heart, or like you said, "Oh, this is gonna burn in my head forever"?
Oh man, I had so many of those, and it's really just helping patients is always such a rewarding such a rewarding experience. But I actually, one of the moments that I really love was in dental school. And let me tell you, I'm sorry for those who are going into pros, or those that really love general dentistry and dentures and whatnot. But I hated doing that stuff. I hated doing dentures. I hated doing all of that. But still, one of my most favorite memories was of this older patient of mine who had a lot of anxiety and had a lot of fear from the dentist. And then over time, she developed this trust with me, and we did all of this treatment for her. And I did dentures for her. And the first time that she saw herself with her new dentures in a mirror, she started crying. And she told me that for the first time ever, she feels like she can smile again. And it warmed my heart. And I was so happy that, not only did was I able to give her a smile again, but also, I helped her get through her fear of being in a dental chair. And she said that, her daughter was getting married, and she was now able to go to the wedding and smile. And it was such a sweet moment. And it was all the way back in dental school, and I'll always remember it.
That's actually pretty good. Any final advice you would like to give our audience, especially our female viewers that are watching? This is all you.
Um, So I would just say, the road is can be challenging, and there could be a lot of obstacles, but you really should stick with it. Whatever career choice you choose, whether it's something in medicine, dentistry, surgery, whatever it is, no matter what the challenges are, no matter what someone is saying to you or trying to, if someone's trying to discourage you or bring you down, just ignore all the background noise and really stick to your passions and to your dreams. If you follow, you know, as cheesy as it sounds, if you follow your heart, you'll end up in the place you're supposed to be. And so, don't listen to the background noise. I get tons of messaging that really breaks my heart from followers who either have family member that are unsupportive, who are like, why are you doing this? Just, you shouldn't do this, or their partners, or their faculty at their school, discourage them from doing one thing or another, that told them that they're not good enough, or maybe this is not the right thing for them. And you should always take other people's advice with a grain of salt, because sometimes it can help you, but sometimes it really tears you down and can deviate you from the path that you want to be on. And so just stay with it, stick to it, make a decision and follow your heart, and you'll end up where you're supposed to be.
Wow, that's very just wrap this up. First of all, I want to thank you on the medical and the team. Thank you so much for coming. The audience was very thrilled. We got good responses. And for the viewers at home, we're gonna say bye to Dr. Rola. Bye, Dr. Rola. For the viewers at home, follow 15 Blades on her social media account. We will list it onto our on our comment
Yes.
section as well. Also follow XME Medical, and we have a research program actually going on too. Follow at EM Research Wing. Research Wing. This is from XME Medical. It's a whole new brand soon, so make sure you follow and subscribe to that. Lots of posters going out, and we'll see you all next time. Bye, Dr. Rola.
Thank you so much for having me. Bye bye.
I as well to make sure again follow EM Research Wing for more updates, and we're making posters. There's on a lot of exciting things program. Make sure and subscribe to that page, and and remember, after this session, give us a review in which we can bring in more guests for you guys, and hopefully better more and more guests for you guys to like appropriate towards different careers. I'll see you next time. Bye bye.